Hi, my name is Dr. Gary D'Ambrosio, and the purpose of this short video is to explain to you what is total body balancing, why should I take this class, and how's it going to help me in my clinic? The best way to explain this is through a case study. I remember a lady, she came down from Montreal, Canada, and she had a 10-year history of neck pain. It was from headaches and neck pain from a car accident. And when I asked her, in the history, she had had lots of chiropractic, she had had physical therapy, massage, acupuncture, but it was all in massage, but it was all done locally. And she had very little change. And if there was some change, it didn't last. So as practitioners, we're always faced with a decision, where do we treat? Do we treat locally at the site of pain, or do we go somewhere else? So what I use, and I teach in the total body balancing class, is the total body screen. And so the total body screen examination, we look at lines of tension in the legs, the arms, the head and neck. We look at the transverse diaphragms. We look at the thorax and abdomen, the autonomic nervous system. When I evaluated her, she had lines of tension in her left leg. It was heavier. There was decreased range of motion. She told me later that she had had surgery on that left foot. She had lines of tension in her left arm, obviously the neck, all her transverse diaphragms, pelvic floor, respiratory, thoracic inlet, tentorium were affected, and the autonomic nervous system. So it's very interesting. When I had her lie on the table, her legs are straight. I'm at the head of the table. I'm at her neck. I'm trying to move her neck. I could hardly move it. But as soon as I asked her to bend her left knee, I could move it a little bit better. As soon as I asked her to bend her left elbow, I could move it even more. So that's our secondary evaluation. We see, oh yeah, you do have lines of tension in the left leg and left arm that are affecting this neck. So she could see it. So she was a candidate for total body balancing. So total body balancing is a total body 5-phase treatment program where we use long levers and we treat in the supine, prone, side lying, and sitting position. Okay? And total body balancing releases lines of tension in the legs, the arms, the head and neck. It opens up the transverse diaphragms, the abdomen, the thorax, and we do it in a very gentle and rhythmical way. It helps to modulate the autonomic nervous system. So she was a perfect candidate because of the lines of tension she had on that whole left side of her body, the diaphragms, ANS. So we did it a couple of times on her, and as a result, her pain significantly was reduced. She had full range of motion afterwards. Her pain level may have been like about a 1. She's still a patient of mine. I do other things with her. But you can see it, she was in tears after that because think about it, she was 10 years, they were treating her locally. That's why I'm so passionate about total body balancing. It doesn't mean that this technique is going to replace what you're doing already. It's an adjunct treatment. You have some patients that you're treating locally, and I have no problem treating people locally, but where people fail is that they don't look at the total body. There could be lines of tension coming in to that area from a leg, an arm, head and neck. And how does an area heal? It heals by blood supply, carrying oxygen and nutrition, energy supply, nerve supply. And in order for it to get that, you need venous drainage and lymphatic drainage. And sometimes these pathways from the area, let's say it was her left ankle, whatever, sometimes those pathways from there to the heart are compromised by fascial restrictions. So total body balancing releases all this tension and creates a better environment for the body to heal at a physiological level. My expertise in this comes from over 30 years of clinical experience working with over 20,000 patients. I started out as an athletic trainer, physical therapist. I'm an osteopath. I'm a doctor of Oriental medicine. I'm also a senior body talk instructor. And so I've been doing this for a long time. And if you get an opportunity to take this, it's probably one of my favorite treatments to get done on my body, because my mentor who taught me this, he was 99 years old, John Wernham. He was still treating 8 patients a day at age 99. He passed in his 100th year, but he thought the reason why he had such longevity is because he had people doing this to his body. It opened everything up. So hope to see you on the course.